Thank you. Thank you for your kind introduction and to the organizers for inviting me. My talk today, as anticipated in the panel this morning, will be about the domain of rehabilitation robotics and specifically neurorehabilitation, so recovering from disorders that have implications both on the neural and on the musculoskeletal system of the human body. And I will discuss a little bit the domain to give you some reference definitions, taxonomies in brief for those of you who are not that familiar with the whole application scenarios. And I will also elaborate a little bit on biomechatronic design principle for these systems and try to focus on three specific case studies on three different systems that we have been developing in our lab in cooperation with other groups in Italy and abroad before coming to some perspectives and conclusions. Concerning the process, rehabilitation process, the simplest way you can present it is more or less like this. You have here the level of activity participation in social context for a given citizen that can be somehow hurted by a pathological event. And from that point, after, of course, an acute treatment will stabilize the situation, avoid complications and possible risks for life. You have this rehabilitation treatment that will last for a long period in time. And as you see, the rate of recovery can vary over time. It will be not that linear, actually, in reality. And the clinical equipe will consider also to change approach if they are not satisfied with the rate of recovery at a given point in time. This could cause the patient to drop down to a lower level of performance, but hopefully then to recover better. And then you will have a kind of plateau. In a sense, the recovery will apparently lose rhythm because the time is a variable that has high incidence, especially in neuro recovery, as you may know. So after some months from the lesion, the plasticity of the brain, of the nervous systems is not that high like in the incipient period after the lesion, after a trauma, whatever pathological event had occurred. And so at that point in time, if the level of success of the clinical therapy is below the threshold